Good morning, everybody. My name is Strbian. I am the member of the Executive Committee of the European Stroke Organization, and I am sitting here in the interview room in the Milan during our European Stroke Organization conference. And we have a special guest today. It's Nikola Sprigg. She is a professor of neurology from University of Nottingham, UK, and she is a principal investigator of the TICH-2 trials. And Nikola is going to present today the results of the one-year follow-up study. So maybe to begin, Nikola, can you please tell us a little bit about the background of the TICH-2 trial and about the results from the last year before the results of the main paper?
Of course. So the main thing is this is a study in people with intracerebral hemorrhage, ICH, and this is the most devastating form of stroke. These people unfortunately have a high rate of early death, and the outcome after this intracerebral hemorrhage is related to the amount of bleeding in the brain, and the aim of the TICH-2 study was to test if the drug tranexamic acid reduced bleeding in the brain. And this drug's very cheap, it costs £12, €12, and can be given very quickly. And we know from other bleeding conditions that it reduces the risk of death. So in TICH-2 we tested this drug in just over 2,000 patients, enrolled from over 125 hospitals across 12 countries over 4 years, and we were looking to see if it affected functional outcomes, so the modified Rankin score of death and disability. And unfortunately there wasn't a significant difference in functional outcome, but there was a significant reduction in both early death and bleeding in the brain, what we call hematoma expansion. So the idea of this sub-study was to follow patients up for 1 year, because there's some uncertainty about what the best outcome measure, the measure of success of a study is in intracerebral hemorrhage, because it's a slightly different condition to ischemic stroke. And there seems to be some evidence that patients with hemorrhage take longer to improve. So it may be that measuring the outcome at 90 days, so 3 months after the stroke, which we did in the first study, in the main study, is a bit too early. So the rationale of this sub-study was to see if we follow patients up for a full year, will more of them recovered.
Excellent. I cannot agree more than there is still something happening even after the 3 months up to 1 year. So could you be so kind and maybe share with us some results of the one-year follow-up study?
Yeah, so unfortunately, in keeping with the results of the main study, there was no significant difference in disability between the groups. There were a number of patients that had continued to improve from day 90 to day 365, but that happened in both the treatment group and the placebo group. What we did find was there was a significant reduction in the number of patients that had died at 1 year. So there was a survival benefit, and that was statistically significant. And when we looked back at these patients, we again found that the patients that had tranexamic acid had reduced bleeding in the brain, and they also had reduced early death, and at 6 months they also had reduced death as well. So there do seem to be some benefits of the drug. It does seem to be reducing bleeding in the brain, but the effects don't seem to be powerful enough to affect disability. The good news was that there wasn't an increase in severe disability, because with intracerebral hemorrhage, as with all stroke, people that we speak to that have had stroke say they don't want to be alive and very disabled, fully dependent on nursing care. And very importantly, we didn't see an increase in that, and there wasn't an increase in the number of people going to nursing homes or institutions. But it does raise some questions about the way we measure outcome in hemorrhage trials, and whether disability is the best measure, or whether actually we need to be measuring things like death earlier on.
Thank you. Do you have any subgroup analysis in this one-year follow-up study?
Yes, so the only subgroup that had a positive interaction, so was statistically, mathematically significant, was the patients that had blood pressure lower than 170 millimeters of mercury. And that makes sense because we know from the INTERACT-2 study and the ATTACK-2 study that if you lower blood pressure, it does improve outcome. And there's been a recent sub-study in the ATTACK-2 study that suggests if you lower blood pressure, it prevents hematoma expansion. So this raises the possibility that there's maybe a synergistic effect of giving a hemostatic agent such as tranexamic acid or blood pressure lowering medication.
Is there anything that you would change in the design of the trial if you would ever do TICH-3 trial?
Yes, absolutely. So when we started the study, we included patients within 8 hours of bleeding, and we since then know that actually tranexamic acid only works if it's given within the first 3 hours in other bleeding conditions.
Okay.
And we only had a third of patients within 3 hours. So if there were to be a TICH-3 or another tranexamic acid study, and I think the question does still need answering, then I think you should only include patients within 3 hours of bleeding.
Thank you. Thank you very much for presenting this data at the European Stroke Organization conference. And I think that everybody would like to read the full text of the trial. Do you know when it's going to be published and where?
Yeah, so the paper's just in final stages of preparation, and unfortunately the journal hasn't been confirmed yet, but we will be letting investigators know once it's in the
Thank you very much.
public domain.
Thank you.